Bothell Regional Health Center is located in Sedalia, Missouri. We've been in existence since 1930. We're celebrating our 85th anniversary this fall. Bothell is serving currently about 75,000 covered lives in Pettis-Benton County. Bothell prides itself on providing comprehensive services including cancer, cardiovascular, women's health. We have a 15-bed skilled nursing facility and also an exceptional joint replacement program. Recently, we've added a wound healing center with hyperbaric. In 2011, Bothell had invested in two major capital projects. One was the Cannon Center for Cancer and Cardiovascular Care. We have an exceptional cancer program that has seen double-digit growth since opening in 2011 with most recent addition of a MU fellowship-trained hematology oncologist. The other significant investment made in 2011 was on the Bothell Arts Center, which is a 56,000 square foot medical office building on our West Campus. That building is currently 75% occupied with physician practices that serve this region in primary care and medical surgical subspecialties. One of the growing needs that Bothell and all of our medical community has is the ongoing succession planning of physicians and providers that will be retiring over the next decade. Our relationship and our participation in the Health Network of Missouri has allowed us to continue to build strong relationships with the residency programs and the fellowship programs at the University of Missouri and have an opportunity for them to know about us, as physician recruiting, provider recruitment is critical to our future. What you may not know is that Scott Joplin wrote his famous ragtime music called the Maple Leaf Rag at the turn of the century that was the first sheet of music to sell over 1 million copies. Since then, Sedalia has been the home of the famous Scott Joplin International Ragtime Festival held the first weekend of June that brings participants from all over the globe. I hope you've enjoyed these Cliff Notes versions of Bothell Regional Health Center. And who's next?
Thanks, John. My name is Gasper Calvary, and welcome to Capital Region Medical Center. Capital Region Medical Center is a 115-bed facility located in Jefferson City, Missouri. Our mission is to improve the health and promote the wellness of the communities we serve. In addition to being a hospital, we also encompass a large medical group of 120 providers located in 8 counties. In fall of 2015, we will be expanding the footprint of Capital Region and changing the experience for our patients. So much of healthcare today is moving towards an outpatient setting. Access, the ability to access physicians and services is the focus of this $38 million expansion that we are going through. The Goldschmidt Cancer Center is one of the premier cancer centers in central Missouri. We are so blessed to have the integrated approach, the largest oncology group in the area, access to clinical trials, access to genetic counseling through the University of Missouri, and a whole array of supported services for our patients. Capital Region Medical Center is the only designated stroke program in Jefferson City, and what that really means for patients is that we are providing the highest quality care in a timely fashion for those patients who have that particular illness. Capital Region Medical Center has been involved in wellness for well over a decade and very much so has been ahead of the curve with regards to other healthcare organizations. And demonstrating that is the Sam B. Cook Healthplex. It's a wonderful facility that provides fitness as well as clinical fitness experts to help our community really get on the path to wellness and to being fit. Our 2 state-of-the-art aquatic therapy pools provide not only therapies for patients, but they're also used for fitness classes. The Health Network of Missouri is really that next step that we need to take as an organization. Partnering with the other hospitals, allowing us to focus on things like quality and lowering the cost of care ultimately is going to help not only our organizations, but the patients that we serve. Something people may not realize or know about Jefferson City is that in 2013, Jefferson City was named Most Beautiful Small Town by Rand McNally. So that's a little bit about Capital Region Medical Center in Jefferson City, and take it away, Todd.
Thank you, Gasper. Hi, welcome to Hannibal. My name is Todd Ahrens, and I'm the President and CEO of Hannibal Regional Healthcare System. At Hannibal Regional, our mission statement, Your Health is Our Mission, points to the fact that the delivery of quality care and good outcomes for our patients is our goal every day. Quality in the delivery of healthcare matters because it deeply affects the lives of our patients, their family members, the community, and our team members. Our organization recently adopted the branding tagline, "Guiding You to Better." This points to the fact that we are in the business of health, not just healthcare. Hannibal Regional physicians, nurses, and staff are committed to providing exceptional service and daily strive to deliver expert clinical care with that extra personal touch. By joining the Health Network of Missouri, we are aligning ourselves with other providers of high-quality health care for the benefit of our patients. At Hannibal Regional, our mission is the health of the communities we serve, and our membership in the Health Network of Missouri helps us guide our patients to better. At Hannibal Regional, we are very proud of the fact that in 2014, our hospital earned HealthGrade's Outstanding Patient Experience Award for the second year in a row, ranking our hospital among the top 10% of hospitals in the nation for patient care. In addition to the Outstanding Patient Experience Award, our hospital is routinely recognized by HealthGrades as providing superior orthopedic care and continues to earn orthopedic-related accolades, including being a recipient of the 2014 HealthGrades Joint Replacement Excellence Award. Hannibal Regional Hospital has also been a 5-star award recipient for total hip replacement for each of the past 4 years and is one of only 5 hospitals in Missouri to be a HealthGrades 5-star award recipient for both total knee and total hip replacement for 2 years in a row. At Hannibal Regional, we are also proud of the James E. Carey Cancer Center, where we recently made a multi-million-dollar investment in facilities and equipment, including a new linear accelerator, an image-guided radiation therapy system that brings advanced radiation treatment to cancer patients in Northeast Missouri. Finally, we're very proud of our baby-friendly facility in the Chris Coons Women's Care Center at Hannibal Regional Hospital. It's been recognized by the Missouri Department of Health as the state's expert on breastfeeding. Some people may not realize, but Hannibal's most famous son is Samuel Clemens, known worldwide as Mark Twain. Many of the popular characters featured in his books, The Adventures of Tom Sawyer, The Adventures of Huckleberry Finn, and others, were based upon people Sam had known while growing up in Hannibal. Today, visitors can still tour Mark Twain's boyhood home, the Becky Thatcher House, the famous Mark Twain Cave, or even take a narrated cruise on the Mississippi River aboard the Mark Twain Riverboat. Come visit us in Northeast Missouri and see our beautiful medical campus. We'd love to have you. And now it's your turn, Mike.
Thank you, Todd. Hi, I'm Michael Hinsey, CEO of Lake Regional Health System, located at Lake of the Ozarks, the Midwest featured lake, 54,000 acres, 1,300 miles of shoreline, and home to approximately 90,000 people. We have roughly 5 million visitors that come to the Lake of the Ozarks throughout the year, primarily Memorial Day through Labor Day. With that, our ER is fairly busy. We see 34,000 to 35,000 ER visits on an annual basis. In addition to that, we're very proud of the fact that we have a cardiology service here, open heart surgery program here. Our cath lab volume is relatively high for a community our size, and our door to balloon time outperforms the national average of 90 minutes. Our current for the last 12 months has been about 46 minutes. We have 3 neurologists on our staff that respond for stroke care and through our ER. Last year we were reviewed and were certified as a state-level designated Stroke 2 center. We're very proud of that. In 2014, it seemed like we had quite a few reviews that year, but one of which we're very, very proud, and that's our cancer center. The center earned re-accreditation with gold level commendation by the ACS Commission on Cancer. Following the survey, Lake Regional was the only center in Missouri to earn an Outstanding Achievement Award from the American College of Surgeons. In May of 2015, the Cancer Center completed an addition to the radiation therapy part of the program, completing an additional vault and a new linear accelerator. The project cost us roughly a little over than $4 million. I think it's very important for Lake Regional to be a part of the Health Network of Missouri. It affords us an opportunity to review best practices, to share ideas, to benchmark data, hopefully to reduce our cost of care to our specific areas. One fun fact that I learned 25 years ago or so when I came, the Lake of the Ozarks at one time was advertised as the land of the magic dragon. If you look from an aerial view of Lake of the Ozarks, the way it's spread out, you can really see the potential for a dragon there. That's a quick look at Lake Regional Health System and Lake of the Ozarks. And I would like to say thank you And now I'll turn it over to Steve Bellish at St. Francis.
Collaboration at St. Francis is a fundamental principle of how we operate. It's evident by the relationship between the board, management, and the medical staff, the relationship between management and the staff that provide our excellent care, whether you're directly involved with patient care or indirectly involved. The collaboration that we have externally with the Health Network of Missouri, for example, a collaborative of 5 other healthcare systems that will be able to provide an entire network of care throughout the state. That type of relationship is designed to further improve the quality of care, to further improve access to care. Those are key tenets for any organization in healthcare today, and I believe we're exemplary in that regard. I think I'm most proud of the relationship that we have with our medical staff and with our employees. There's a direct correlation between employee satisfaction, patient satisfaction, and physician satisfaction. And I believe we've done an outstanding job in creating the environment where employees can do their job, the physicians have an outstanding environment which to take care of their patients using their God-given skills. It's a pretty special place. We don't have the same issues many other organizations do in healthcare today. We're financially strong. We've got great patient satisfaction scores. We have great satisfaction scores with our physicians, and we've been a best place to work for 6 consecutive years as a top 100 hospital in that regard. I think that's all critical in accomplishing what we've been able to over these last 16 years. One of the unique things about Cape Girardeau is that we are on the right side of the state, literally the right side. We are the home of Rush Limbaugh, so we have a conservative tendency. However, since joining the Health Network of Missouri, we've become a little bit more liberal. We've even had Hollywood here. Gone Girl was filmed in Cape Girardeau, Missouri. In fact, during that filming, Ben Affleck worked out at the St. Francis Health and Wellness Center, which obviously drew a large monthly membership during his month here in Cape Girardeau. And now I'd like to pitch it to Mitch Wasden. Mitch?
Thank you, Steve. I'm Mitch Wasden. I'm the CEO and COO of MU Healthcare. I'm excited to be here and welcome you to Columbia. The university has had a long-standing tradition in Columbia and in mid-Missouri for being a level 1 trauma center and having a level 1 stroke center and doing a lot of things that the middle of the state needs. But what we're really excited about is where healthcare is going in the future, using the Health Network of Missouri to help transform the way we take care of populations. Here at MU Healthcare, we're proud to offer care for our patients who need all levels of treatment. We're partners with Hy-Vee grocery stores to offer quick care clinics staffed by nurse practitioners. We've also opened the South Providence Medical Building, which is now home to 3 outpatient clinics, including family medicine, general pediatrics, and psychiatry. Our hospital system also includes the area's only women's and children's hospital, which now has the designation of baby-friendly. Our Ellis Fischel Cancer Center is an affiliate of MD Anderson Cancer Center, and surgeons at the Missouri Orthopedic Institute are preparing to showcase their work replacing joints with donor tissue. They're using a tissue preservation method pioneered by researchers at the University of Missouri. Something that was kind of exciting for us this year is the University Health Consortium ranked the university as a top 10 academic medical center. And that's out of a list of very impressive centers, and so Mayo made the list, Cleveland Clinic made the list at 10. The university was actually number 9. MU Healthcare is also proud of the collaboration with the Tiger Institute to provide patients with an online portal to schedule appointments, read test results, and even see their doctor's notes. In the future, our partnership will take us further into the world of telemedicine and mobile technology to better serve patients and coordinate their care between home and the hospital. The city is, of course, home to the University of Missouri, but you may also come here to visit festivals like True False, Roots and Blues, and Barbecue. What people might not know is that the Columbia area is home to 2 daily newspapers. So if conventional wisdom holds true, Columbia is home to the most journalists per capita, which is for better or worse. Dr. Williamson likes to say that the problem with our city is that there's 2 reporters for every story. So we get well covered. So finally, in closing, I would like to just thank all the members of the Health Network of Missouri. It wasn't many years ago when we were all just a learning collaborative, and in the last couple of years we've taken huge strides to look at ways that we can manage population health and really be an example of the way a national collaborative can be successful. We've even had the opportunity to share some of our best practices at national conferences, and I think this is just the beginning of us being a best practice throughout the country and what a rural health collaborative could look like. So on behalf of the University of Missouri, I would just like to congratulate and thank everybody for being part of the Health Network of Missouri team.